So today we're going to be providing an update on the data and the sources of data that we've been collecting for the GM Moving evaluation. Just to remind you, this is over and above the work that we do on the Greater Manchester local pilot and focuses on partners and ways of working across the entire system. And we will be presenting some of the findings from that data capture exercise relating to two kind of key themes. One is the extent to which physical activity might be seen to be integrated throughout the system, and the other is really focusing in on the ways of working that GM Moving are trying to advocate and the extent to which that is being assimilated into practice. So first of all, looking at the sources of data that informs this report, the findings are based on a policy audit that was undertaken by our colleague Mike Parker, and he looked at 23 policy documents which might be considered to be GM wide to explore the extent to which they reference physical activity and Greater Manchester Moving. We've undertaken interviews with 20 key partners, senior stakeholders from across the system, and we've also got some initial data from our stakeholder perception survey that we're going to feed into the results, just to say that this is still being fully analysed, and so these are indicative results at this stage. So let's just move on then and think about the actual findings that we're sharing today. So first, taking a look at that policy audit, well, of the 23 identified policies, we noted that 11 directly reference Greater Manchester Moving and 17 had specific priorities and actions around physical activity. But there were gaps. There were gaps in the Children's and Young People's Health and Wellbeing Framework, the Primary Care Strategy, the Local Industrial Strategy, and the Crime and Justice Strategy. We note that these policies are at the end of their lifespan, and that Greater Manchester Moving stakeholders are working with the stakeholders in these sectors to try to raise the profile of physical activity. But it's useful to note that those are current gaps in the policy landscape. One indication that things are changing is the extent to which physical activity has been invited and is featured heavily in the COVID-19 recovery plans for Greater Manchester, and we note that there is a commitment to create space and infrastructure for walking, cycling, with a focus on community and social prescribing. One thing to note is that we really strongly recognise that just having a policy doesn't necessarily mean that there is any key action on the ground, and we noted through our policy audit that there were fewer directed plans for implementation and how this was actually going to be achieved in practice. One key recommendation arising from the work, therefore, is that stakeholders involved in GM Moving really focus on pressing their cross-sector colleagues to identify ways in which they're going to operationalise physical activity within their sectors. So let's move on and think about some of the feedback that we got from partners who are involved with Greater Manchester Moving. And one of the initial questions that we actually asked is, what is GM Moving? It seems like a simple question, but one of the participants said, well, inside and outside of GM Moving, if you asked 20 people, I expect you would get 20 different answers. Well, if you recall, we did ask 20 people, and well, you can see for yourself that this particular participant was right, that we did get a very wide range of answers. One thing that we can probably say describes the commonalities in these responses, though, is that the perception of GM Moving has moved away from it being an organisation or a sort of entity which is bounded by one particular organisation or institution, but has really developed in people's understanding from the previous evaluation that this is about a social movement, or about a wide-reaching, almost amorphous group of network of people who are interested in supporting physical activity. And it's also clear that people don't perceive GM Moving to be a multi-level or multi-sector programme of interventions. In fact, they were at pains to say that it certainly wasn't that programme of interventions. And one quote here from one of the partners: if you start to build it within the hierarchy of a programme, I think you'd immediately restrict it if you did that, sort of really showing the difference between something which is bounded versus something which has the potential to grow and influence and enhance the work across the whole of Greater Manchester.